This is 22.2 specific groups exercise prescription. So contraindications. Contraindications are physical or mental conditions which increase the risk involved in engaging in particular activities. There are two types, which are absolute and relative. So absolute, no exercise should be done under any circumstances, like if you have a recent heart attack, severe illness and fever, or bad infections. And relative, they're less threatening but still dangerous. So for example, high blood pressure, liver disease, and advanced pregnancy. Contraindicated exercise is something like a sit-up. So individuals used to do it straight leg sit-ups, but this exercise does more harm than it does good. Firstly, I'm going to talk about contraindications for children. So asthma is a disorder that affects the respiratory pathways and the airways become obstructive. Asthma, so activities that involve short intermittent periods of exertions like volleyball, gymnastics, wrestling are usually tolerated by people with asthma. But activities involve long periods of exertion such as like football, long distance running, basketball, hockey, they may be less well tolerated. Also, cold weather sports such as ice hockey, cross country skiing, ice skating, they also pose challenges for people with asthma. The recommended sport for someone with asthma is swimming. It can be a strong endurance sport, but is generally well tolerated because it's normally performed while breathing in warm, moist air. So that's what's best for asthma. It's also an excellent activity for maintaining physical fitness. So frequency, they should be doing this 4 to 5 times a week. Intensity, around 70 to 75% of maximum, and then after the first couple of weeks, this can be increased to 80% of maximum. Time, they should usually do it for about 50 to 60 minutes, and obviously the type of this will be swimming. The next contraindication is obesity. So there are some problems which can occur during childhood which makes exercising dangerous for the individual. So cardiovascular disease such as coronary heart disease. Obesity can also cause type 2 diabetes, osteoarthritis. So this is more likely to occur when a child is older. However, it's like stemmed from when they're at a young age if they have obesity, as well as suffering physical and physiologically, the individual can suffer mentally. So the recommended sport, which is prescribed, is a game sport. So this is good because the individual will be able to make friends. So it's also very social as well as healthy, and it's also getting them fitter. If they're really, really unfit and quite overly obese, they shouldn't really be doing vigorous maximal exercises, because if you're suffering obesity, arteries become blocked, which means that there's a build-up of fatty deposits. And if they suddenly go to exercise for the first time, and it's maximally, exercise could cause a reduce in blood going to the heart, causing a heart attack. Therefore, they need to build up their fitness slowly. So the frequency would be 3 to 4 times a week for the first 2 weeks, and then increase this to 4 to 5 times a week. The intensity should start about 60 to 70% of their maximum, and then increase to 70 to 80% of their maximum. And the game should be up to like 40 minutes in practice for like the first 2 weeks. And types of game sport, so girls ideally would be netball, boys probably be basketball. Another contraindication is bone problems. So this could be brittle bones or even osteoporosis. Children can have low bone density and they're therefore vulnerable to fractures. So for individuals like this, certain sports would need to be avoided, such as rugby. This because it's like a contact sport, and individuals who have brittle bones or low bone density is more likely to suffer from fractures. For these individuals, non-weight-bearing exercises should be done regularly, such as swimming or even cycling. However, in some cases, it's like not a good idea to strengthen the bones by doing weight-bearing exercises, so such as like jogging. This has to be regulated, as it could be damaging the bones further without noticing. So the prescription exercise is like jogging, With these individuals, it's very important that they run on a soft surface, such as grass or a running track. They shouldn't run on concrete as it can damage your bones even further. Exercise classes are also run by the NHS for children with bone problems. There'll be like a qualified teacher teaching all the exercises that have been trained in a specific area. So these classes are run for an hour once a week. The jogging should be done 3 times a week for the first month to help the bones adapt and strengthen. This can be raised to 4 to 5 times a week. The intensity should be high, about 80% of their maximum. Time for around 30 minutes for the first week, and then increases to 40 minutes for the next week. The types are obviously jogging on a running track or a soft surface. The next group is older population. So one of the contraindications of the older population is osteoporosis. So this is a disease where increased bone weakness increases the risk of a broken bone. So it's like one of the most common reasons for a broken bone among the older population. It's very important that this older population don't do contact sports if they are suffering from osteoporosis, because it makes the bones weaker as they become less dense, so they're more likely to break. Also, minimal weight should be used, if at all, because it puts stress on their bones, which can cause little fractures in their bones. So the prescription is flexibility exercises and swimming. So frequency for flexibility exercise should be 2 to 3 times a week. Intensity should be to the point of discomfort. Time, they should hold the stretch about 10 to 15 seconds. And type, they should work on all major muscle groups. Another prescription is swimming, because this is non-weight bearing. Should be done 3 times a week in the intensity of 60% of their maximum, around 30 to 40 minutes. Because swimming is non-weight bearing, it keeps all the stress off their bones, but also enables them to keep fit. Another contraindication is low blood pressure. So hypertension is one of the medical terms for low blood pressure. So it's less than 90/60. The blood pressure reading appears with 2 numbers. The first and higher of the 2 is systolic pressure. So the pressure of arteries when the heart beats and fills with blood. This means the individual, so yeah, that's the first number, and then the one underneath is normally the lower number, that's diastole, so it's when it's relaxing. People who suffer from low blood pressure means they feel lightheaded and dizzy when changing direction suddenly. So this is a contraindication, as they may pass out due to being really dizzy. So for people with low blood pressure, exercise can trigger the symptoms associated with a drop in blood pressure, because a sudden change in posture can bring on symptoms. So it's best to avoid exercise positions in which your head is like lifted suddenly from below the heart or level with the heart. So people with low blood pressure can consider aerobic and resistance exercises such as like swimming, rowing, light weightlifting, jogging and Pilates. And because vigorous exercise can make symptoms worse, it's important that you start the exercise routine slowly and slow down gradually before ending the routine. So the recommended prescription is cycling. It's good for the older population with low blood pressure because it doesn't involve rapid changes in direction or quickly standing up then quickly sitting down. So frequency is 3 times a week, intensity of 60% of the maximum, time 20 to 40 minutes, and type it's non-vigorous cycling that doesn't involve many hills because this could cause strain over which could affect your blood pressure. So the next contraindication is previous hip replacement surgery. So hip replacement surgery is a procedure in which a doctor surgically removes a painful hip joint with arthritis or some other form that makes it painful and replace it with an artificial joint, often made from metal and plastic components. So it's usually done when all other treatment options have failed. So this can be a contradictive exercise because it increases the risk involved when engaging in a particular activity. Recommendations to this exercise include a range of movements. So when doing it, you may feel uncomfortable at first, but these exercises will help speed your recovery and hopefully diminish your post-operative pain. So you can do ankle pumps, slowly push your foot down and up, ankle rotations, supported knee bends, glutes contractions, adduction, quadricep sets, and straight leg raises. Also walking, but this will be after 2 to 3 weeks of surgery. Each exercise should be done 2 times, and it should be done 5 times a week. After 2 weeks, the exercise should be increased to 4 sets and 6 times a week. The last group I'm going to talk about is pre and postnatal. So during pregnancy, women go through a rapid amount of physiological changes. So there are risks involved with some exercises. However, women understand the benefits of staying healthy during pregnancy. Some contraindications of exercise pre and postnatal are high and low blood pressure. So it is normal for your blood pressure to change a little during pregnancy. One hormone during pregnancy relaxes the walls of your blood vessels, so this may make your blood pressure fall during pregnancy. So this could mean dizziness and sometimes even fainting. So exercises don't want to be too vigorous, and there doesn't want to be big changes in height. So recommendations, there would be aqua fitness. This is a non-weight bearing, slow movement exercise. There are prenatal classes that are on specifically for pregnant women at different stages in their pregnancy. So one could be 3 months, the next one could be 4 months, and the next one up to 9 months. Frequency should be done around 1 to 2 times a week. Intensity 40 to 50% maximum, because it doesn't want to be too vigorous. Time, they usually last around 40 to 60 minutes. And type is non-weight bearing. Obesity during pregnancy can increase the risk of a miscarriage. The overall risk of a miscarriage under 12 weeks is 1 in 5. If you have a BMI of over 30, the risk is 1 in 4. Another risk is blood clots. So all pregnant women have a high risk of blood clots compared to women who are not pregnant. And if your BMI is 30 or more, your risk is additionally increased. There's also many risks of the baby as well as the mother. So one prescription for obesity during pregnancy is cardiovascular fitness recommendations. So it'd be power walking or light jogging. So frequency 5 to 7 times a week, intensity 40 to 60% maximum, time 20 to 60 minutes, and type low impact, so it's important for prenatal. So surgery postnatal, so this is normally your C-section, should avoid all exercises that put pressure on the abdomen, such as sit-ups. No exercises should be able to stretch the abdomen either. So one recommendation is swimming. So it's non-weight bearing and it takes the pressure off from the surgery area and it keeps the individual fit and healthy. So frequency would be 2 to 3 times a week. Intensity around 50 to 70 maximum. Time 30 to 40 minutes, and swimming would be the type, which would be low impact.